Off with your name.
Alvin Brent, B-R-E-N-T.
And you,
I was a nephrologist.
a nephrologist.
Right.
Here in Jackson, Mississippi.
Yes.
When did you start?
Oh gosh, I finished mid school in, I was class of 63. Then I stayed, did residency and nephrology fellowship till 67. And that's kind of before kidney dialysis got cranked up, but I was a practicing nephrologist. And a few years later, chronic dialysis came in, and I came back and did a little more training and did chronic outpatient dialysis. Where I was Dr. Bauer's first fellow. He was the head of nephrology here, and I was the first person to do a fellowship under him.
Okay. And so you've been here your whole career. You went to medical school here too?
Yeah, I'm from Jackson. My daddy had a drugstore here, so born and raised right here.
How has medicine evolved during your time? Besides the dialysis, which is certainly the big factor, what else has occurred?
Oh gosh, so many changes. Now they literally have mannequins that they can push a button on a mannequin to say, deliver a baby with a cord around its neck. Push another button, deliver a breech birth. They actually have actors that will come in and be, pretend to be patients and describe symptoms and all that patients would have. So it's very different. One thing that hadn't changed, I don't think it ever will, they still dissect cadavers. And I think that will stay, and I hope it does, because that kind of gets you, if you can dissect a cadaver, you can look at burns and bad wounds and surgery and all that, so I hope that'll stay. But med school here is absolutely just second to none. When I think about my education, I think back like Dr. Arthur Guyton. He was head of physiology here.
Arthur Guyton's famous for his books.
Absolutely, and his textbook of physiology is still probably the standard textbook of physiology, no matter where you go. And they kept that textbook up. And every time I'd run into doctors, and it could be out of the country or anywhere in the country, and they'd hear us from the University of Mississippi, "Oh, did you have anything to do with Dr. Arthur Guyton?" And I said, "Well, yeah, he gave probably 80 or 90% of our physiology lectures, and there's no more course in basic medicine probably than physiology. And he gave, I bet, 90% of our lectures, a lot of hands-on teaching and stuff.
Did you do teaching also?
No, I practiced general internal medicine, and then nephrology kind of came in, chronic outpatient dialysis, and I got into that. And I was involved some at the medical center, but mostly I was in private practice.
So besides the dialysis, what else has changed in the nephrology field?
One of the big things coming along that has just got kind of cranked up is what we call xenotransplants.
Renal transplants, yeah.
This is animal to human.
Oh.
Can you imagine if you could do a pig kidney into a human? You eliminated the need for dialysis. I mean, you're going to eat the pig anyway, so
yeah.
You hadn't lost anything. And that's but that's in the future, but it's down the line, but it seems to be getting cranked up.
Were you involved in the early transplants of kidneys at all?
A little bit. The kidney transplant has been around for a while, and Dr. Bauer, the guy I was just talking about, who was a nephrologist here, he started out in Virginia. He was doing kidney dialysis, keeping people alive so they could be transplanted. And somehow along the way, he realized, we can't transplant all these people, and they're doing pretty good just, on dialysis. So he was on the ground floor of initiating chronic outpatient dialysis. I can't remember what year that is exactly, but he was absolutely on the ground floor of chronic outpatient dialysis. And I was blessed and came in and did a fellowship under him.
What about the way medicine is practiced? Your brother-in-law, Willard Bogan, used to make house calls and stuff like that. How do you see the interactions now between patients and the physicians and things like the nurse practitioners taking responsibilities?
Well, it is different. I don't think there's any such thing as house calls anymore. When I first went into practice, I made a few, and I didn't like it. It was not fun. But it's all non-house call. It's telephone. It's computerized, and it's different. But I think it's better. I think we do a better job now. I really do.
Better jobs in what way?
In patient care primarily. I can get help if I've got something I'm not too sure about. I can get right on the computer or get help some other way to know exactly how to take care of this problem or when to send it to somebody else or that sort of thing. I think it's a better.
It's better now.
It's different, but I do think it's better.
We hear a lot about physician burnout. Did you have experience with that, or knew people who are having problems with burnout?
I had a little of that. I think I retired when I hit 68, and I was ready.
Okay.
I really was. It was different. The new people coming in, and they were ready for me to go, I think, and I was ready to go.
Do you still keep up with medicine these days?
I try to. It's kind of gets away from it, but yeah, I do CMEs and I keep my license up, but I wouldn't write you a prescription.
Would you recommend if for your child or relative to go into medicine as a field?
I think I would. Yeah, I enjoyed it, and like I say, it is different now. I mentioned how the medical school itself is different now. It's not all, when I came through, it was all person to person. I took care of people. Now a lot of it is computerized and fake bodies, but it's still good. And
What do you see for the future of medicine?
more of the same. I think it's going to be less and less actual hands-on patients. Going to be more and more computerized.
Like telemedicine, maybe?
Yeah, telemedicine. I think it'd be a good bit of that.
Do you have any regrets about your career?
Not really. I really don't. I enjoyed practicing medicine. Made a good living at it. I had good people I worked with, and I was working under Dr. Bauer and Dr. Ben Johnson at the Med Center here. I was on the ground floor of dialysis, getting cranked up and coming out. Made a good living at it, but I enjoyed it. Yeah, absolutely.
If you had to talk to somebody new coming in, a medical student who's just starting a career, what kind of advice would you give them?
Be careful where you go to school. I really enjoy, our school here to me was absolutely second to none. The faculty and the staff and the hands-on, whereas some of these bigger med schools with thousands of patients and students, it's just, to me, it's not the same as a hands-on deal like we had here. I knew the faculty we worked under, and like I mentioned, people like Dr. Arthur Guyton work under people like that. This is second to none.